Welcome back to Carolina AM. A familiar face to our show over the last few months, and that's here at AIM Acupuncture and Integrative Medicine in North Myrtle Beach, and Dr. Tanya Weber. And Tanya, thank you so much for having us back.
Oh, thanks for coming again. We love to have you.
Thank you. And this has been an education for me, a lot of our viewers over the last recent months when it comes to acupuncture, some of those things you treat. But for the folks that have never met you before, let's talk a little bit and give them an overview of AIM.
So AIM, Acupuncture and Integrative Medicine. We do a little bit more than acupuncture here, but before I go down that rabbit hole, just we focus on the chronic things, the things for which there seems to be no hope. That's where we excel.
Yeah, when your doctor says, we're just going to throw some...
Oh, and listen, you're going to have to live with this. You're just getting older, Greg.
Those kind of things.
I hate that. That happens too often.
Or they write a prescription.
Right.
And listen, some of those things are good.
They are.
But not all the time.
But when you're taking 16 pills and they give you 3 more, right? I mean, the FDA does drug studies on pill A and pill B and pill C individually, but they never do drug studies on what that soup of A, B, C and add up to 16 do for you.
Well, so if you're having pain and you can't find an answer, maybe Tanya and her staff have the answer.
Yeah, especially I'm really known for neuropathy, failed back surgeries, fibromyalgia, autoimmune issues. These are the things that I'm kind of known in the acupuncture world for.
You've dedicated a great deal of your life. Don't cut yourself short.
Well, 20 years.
You've done this for a long time.
20 years and I'm only 21.
A long time.
I know.
I know. It's wonderful. You age so well.
I haven't I though?
Okay, so here's a question for folks. That you may have a patient here. They're going out of town. They may be a snowbird because this area...
big snowbirds,
It is a snowbird community. But you have a network of doctors that you consult, you train. Yeah. So wherever they happen to be going, traveling, or going back to another home.
It's a good chance that we've got someone trained by me there.
Talk about that a little bit.
So we can offer you continuity of care is what it comes down to. You know, maybe you are a snowbird, or maybe you live here, home base here, and you travel elsewhere. I was just telling you before the cameras started rolling about our gentleman. We have a gentleman in Hawaii right now. I won't use his last name, but Mr. Richard is in Hawaii. Poor thing, he's got to be in Hawaii till November.
But it's tough, but he can still find help if he needs it. They are in Hawaii.
And yesterday, I was on the phone with Dr. Sherry, and actually, I'm going to need you to put your foot up here.
Me?
Yeah, you.
I don't think I can stretch it up to my knee.
But no, yesterday I'm on a Zoom call with Dr. Sherry out there in just outside of Honolulu.
Yes.
And I had my husband come in my office at home, take his shoes off, put him up on the desk. I grabbed a magic marker and I started drawing on his leg and his foot because we're treating him for some neuropathy and some atrophy of some muscles down there.
Okay.
And I wanted to make sure she was doing exactly what I had been doing here because it was working so well for him. So this is the kind of continuity that we can offer you. We've got another lady that's on an RV trip across the U.S. So she's going to spend a month here, a month there, a month there, and we've got her lined up with providers for her entire trip out and back.
So basically, Tanya, you can help them whether they're here, whether they're there, whether they're anywhere. You can help them.
You know, if you have a loved one that doesn't live here, that maybe if they were here, you might send my way, just call us and we'll see if we can't help them anyway, wherever they might be.
That's wonderful. For folks that maybe want to come in for the consultation's free.
Yeah.
Just come on in and visit.
Yeah, come on in.
It's that easy.
It's that easy.
Why don't we give them a phone number, website?
You always make me do the hard things.
I do make you do the hard things.
No one knows their phone number these days. You just hit redial. So it's like 843...
We'll put it on the screen.
Yeah.
How's that?
Yeah. 843-273-4467, I think.
That's good. Check the number on the screen.
But our website is easy.
Okay, tell us.
AIMLiveLife.com.
That's the best way to do it.
AIMLiveLife.com.
Well, AIM to come on and see Dr. Tanya Weber, the entire staff here at AIM in North Myrtle Beach.
We aim to make you feel better.
I love that. And she aims to always make things go really well on camera, and you did that again today. Thanks for watching. We'll be right back with more of Carolina AM.
See ya.
It's the Greg and Tanya Show.